Sometimes people fail to mourn and instead have abnormal grief reactions. If you have gone into complicated mourning, then you have gone into the darkest of grief. From the darkest of grief, you can find the light again. There are 7 major areas that can influence the type, intensity, and duration of grief. Relational variables define the type of relationship the person had with the deceased. The most frequent type of relationship that hinders people from adequately grieving is the highly ambivalent one with unexpressed hostility. The type of grief that comes from this type of relationship usually portends excessive amounts of anger and guilt, which cause the survivor difficulty. Another type of relationship that causes difficulty is a highly narcissistic one, whereby the deceased represents an extension of oneself. To admit to the loss would then necessitate confronting a loss of part of oneself, so the loss is denied. In some cases, the death may reopen old wounds. Highly dependent relationships are also difficult to grieve. For the person who loses an excessively dependent relationship, feelings of helplessness and the self-concept of being a helpless person tend to overwhelm any other feelings. Personality factors are related to the person's character and how this affects his ability to cope with emotional distress. Strong people, and usually this self-concept is socially reinforced, often do not allow themselves to experience the feelings required for an adequate resolution of a loss. Grief is really a social process and is best dealt with in a social setting in which people can support and reinforce each other in their reactions to the loss. 3 social conditions may portend or give rise to complicated grief reactions. The first is a case in which the loss is socially unspeakable, which often happens in the case of suicidal death. This conspiracy of silence causes great harm to the surviving person, who may need to communicate with others to resolve his or her own grief. A second social factor that complicates a grief reaction happens when the loss is socially negated. In other words, when the person and those around him act as if the loss did not happen. But the loss still needs to be grieved, and if it is not, it may surface later in some other situation. A third social dimension that may cause complications is the absence of a social support network. Those who were the most angry following the loss of their husbands also experience the highest degree of social isolation. This not only makes grieving more difficult, but probably serves to increase the amount of anger. There are several complicated grief reactions. A chronic grief reaction is one that is excessive in duration and never comes to a satisfactory conclusion. Even though the person is aware of the condition, chronic grief does not necessarily resolve on its own. This awareness is particularly strong when the grieving has gone on for several years and the person is feeling unfinished. Overwhelming feelings at the time of the loss may cause the person to delay their grief. This is often true in the case of a death by suicide. Exaggerated grief reactions are when a person experiencing the intensification of a normal grief reaction feels overwhelmed and resorts to maladaptive behavior. Anxiety is another common response following loss. Serious alcoholism or other substance abuse that develops or is exacerbated by a death would be included here. There are some who suffer loss, usually a catastrophic nature, who develop signs and symptoms of a post-traumatic stress disorder. Masked grief reactions are interesting in that patients experience symptoms and behaviors which cause them difficulty but do not see or recognize the fact that these are related to the loss. They develop non-affective symptoms which are seen as affective equivalents of grief. If a person does not express feelings in an overt manner, this unmanifested grief will be found expressed to the full in some other way. People may have absent grief reactions because their ego is not sufficiently developed to bear the strain of this work of mourning, and that the person uses some mechanisms of narcissistic self-protection to circumvent the process. Masked or repressed grief generally turns up in one of 2 ways. Either it is masked as a physical symptom, or it is masked through some type of aberrant or maladaptive behavior. Persons who do not allow themselves to experience grief directly may develop medical symptoms similar to those which the deceased displayed, or they may develop some other kind of psychosomatic complaint. There are a number of clues to unresolved grief reactions. Clue 1 is the person being interviewed cannot speak of the deceased without experience intense and fresh grief. Clue 2 is some relatively minor event triggers off an intense grief reaction. Clue 3 is themes of loss come up in a clinical interview. Clue 4, The person who has sustained the loss is unwilling to move material possessions belonging to the deceased. Clue 5. Those who make radical changes in their lifestyle following a death, or who exclude from their life friends, family members, and/or activities associated with the deceased, may be revealing unresolved grief. Clue 6. A compulsion to imitate the dead person, particularly if the client has no conscious desire nor competence for the same behavior, comes from the need to compensate for the loss by identifying oneself with the deceased. Clue 7. Although self-destructive impulses can be stimulated by a number of situations, unresolved grief can be one of those and should be considered. Clue 9. Unaccountable sadness occurring at a certain time each year can also be a clue to unresolved grief. Clue 10. A phobia about illness or about death is often related to the specific illness that took the deceased. Clue 11. If they avoided visiting the gravesite or participating in death-related rituals or activities, they may be harboring unresolved grief. Therapy can help resolve unresolved grief, though it may take a little bit, since a therapist would have to dig really deep to unravel the whole mess that's been going on for several years.